Nehawu is briefing the media in Braamfontein in Johannesburg. This is about the ongoing public sector strike following the collapse of wage negotiations. Let's take you there live now.
In March 2023, the National Union embarked on an industrial action as a result of the collapsed wage negotiations, continuous implementation of austerity measures, and the aggressive attack on collective bargaining by the government. In the main, this was in response to the employers' unilateral implementation of 3% wage increase for the 2022-23 financial year in the middle of an unresolved dispute and the defense of the collective bargaining. This collapse has really brought new escalations of miseries, pains, and suffocation that threatens their historic gains and meager livelihood to public service workers and their families. In November 2022, the employer went on to unilaterally implement a 3% salary increase that was rejected by majority unions at the SABC. The unilateral implementation of 3% increase in the middle of the dispute represented yet another attack on the collective bargaining, as it happened to the last leg of Resolution 1 of 2018 in 2020. To put the imposed 3% wage increase in perspective, we have to remind the public that in 2020 to 2021, the public servants suffered a major wage cut as a result of the employer's decision to renege on the implementation of Clause 3.3 of Resolution 1 of 2018. Let's not forget that this cruel decision was taken in the middle of the COVID-19 pandemic, when the entire population largely relied on the sacrifices and diligence of the public servants in the front line of service delivery, especially the healthcare workers. In 2021-2022, the employer merely offered a non-pensionable 1,000 rands cash gratuity and no increase in the salary baseline. This meant that, on average, public servants lost about 4.5% in the value of their salaries as a result of inflation, which also affected salary notches and the total package of their future pension payouts. The 2022-2023 offer is still in dispute, hence our strike. We are resolute in rejecting 3%, given the average inflation rate of nearly 7% in 2022-2023 financial year. We could not jump into a new wage bargaining round for 2023-2024 when the employer has effectively just unilaterally imposed a wage cut of 4% in the pay packet of an average public servant. At stake is not just the wage dispute of 2022-2023. It is also collective bargaining, given the unilateralism that is now prevailing in the public sector. As Nehawu, we also want to put the employer on notice that we are now in consultation with our lawyers over the imposition of 3% for the 2022-2023 financial year. We want to draw the public to the attention of the fact that Clause 3.3 of Resolution 1 of 2021 states that if no new agreement is reached by 31st March 2022 on the 2022-2023 salary adjustment, this non-pensionable cash allowance shall remain in force until a new agreement is entered into by parties. There was no agreement on the 2022-2023 salary adjustment, and therefore the employer is once again in violation of the agreement that it has signed. As Nehawu, we remain unwavering and consistent in rejecting unilateralism and the erosion of collective bargaining in South Africa. There is a growing tendency and a deliberate efforts to undermine collective bargaining aimed at rendering the SABC devoid of power and purpose, as this is more evident now. Indeed, the government is resolute on withering away collective bargaining. In the middle of the current dispute of 2022-2023 financial year, the employer opportunistically embarked on the 2023-2024 public service wage negotiations, wherein they are effectively offering public servants an insult 0.5% salary increment. They even have an audacity to mislead and confuse workers and the public by stating that their offer is 4.7%, whereas they just converted the cash gratuity that workers have been receiving into the baseline. We need to clarify that the percentage that the employer is actually offering is a mere 5%, 0.5%, due to the fact that the gratuity, which is 4.2%, will now go into the baseline, which means that the workers are once again robbed by the government. In addition, the conversion of the 1,000 cash gratuity into a 4.2 wage increase to the pensionable baseline is going to be regressive, and therefore at the expense of workers in the lower salary levels. For example, a 4.2% increase on salaries of 15,000 will amount to 630. Therefore, the 4.7 offer is effectively another pay cut, as it falls far below the current inflation rate, which is at 6.9%. The sixth administration has deliberately condemned workers into abject poverty by consistently ensuring wage adjustments are far below the average cost of living. Our members and workers in the public service have had to endure the onslaught of this sixth administration in many ways, including poor working conditions and intensified workloads due to pervasive vacancies. Yet, as workers in the public service and the state in general, our daily work contributes to the betterment of the South African people, especially the working class and the poor in the front lines of service delivery. As Nehawu, we reiterate once again that this sixth administration is hell-bent on destroying collective bargaining rights of workers and made it as its task to reverse and roll back the gains made by workers over the years. It is evident through numerous actions and continuous appetite of approaching labor courts in resolving matters of collective bargaining as opposed to taking an advantage of institutions of dialogue such as bargaining council to resolve matters. Having noticed that the union is resolute and firm in its pursuit of the strike, then government decided to approach the courts to interdict our national strike. On the eve of the commencement of the strike, the Department of Public Service and Administration approached Labour Court filing an urgent interdict against the strike. The court granted DPSA the order. We immediately filed an appeal on that order, which meant that by implication, Rule 18 of the Superior Courts Act 10 of 2023 kicked in. This rule automatically suspends the operation of court order until leave to appeal is determined, and thereby allowing us to commence with our strike. Once again, the DPSA urgently approached the court to file for an urgent application for the execution of the order. The matter was heard on Monday, the 6th March 2023, and the judgment was delivered on the same day, with the department being granted an execution order. The union subsequently launched an automatic appeal at the Labour Appeals Court in terms of Rule 18 of Superior Courts Act 10 of 2023, which also suspended operation of the execution of the order by Justice van Niekerk. On Friday, the 10th March, the Labour Appeals Court heard our appeal on the execution order of the interdict by DPSA, and after hearing all arguments, it reserved judgment until Monday, the 13th March 2023. The National Union will await judgment and will immediately meet its lawyers for legal recourse to be considered. As Nehawu, we remain resolute that no amount of litigation or intimidation by government will deter us from this noble, worthy cause that we have embarked on, fighting for public servants, defending collective bargaining and the rights of workers. It is the fact that in the course of the last few days, the strike has registered some victories. Key amongst these victories is the SABC facilitation process, which enforces government to go back to 2022-2023 discussions on salary of public servants. At the same time, we have managed to engage with several provincial health departments, and this led to the institutional management and our structures working out modalities to ensure access to hospital services by our communities. We must draw the public attention to the fact that to this day, since promulgation of the Labour Relations Act, the employer has been refusing to engage on a framework for the minimum service level agreement. They have been bogged down in their position of depriving public servants their right to strike. On the 7th March 2023, the PSCBC invited the union along with other parties in dispute to the facilitation process in order to try and break the impasse or strike action that commenced on the 6th March 2023. Indeed, we met with an employer on Friday, the 10th and 11th, 2023, through the facilitated process where we presented our issues, and the employer replied by saying that they were not averse to the process. To our dismay, the negotiators of employer made the U-turn when we thought that we are registering progress by indicating that they are no longer interested in negotiating a settlement agreement to resolve the impasse. The employer arrogantly demanded that we must drop the dispute process and return to the council to engage on the 2023-2024 public service wage negotiations. Again, this is another demonstration of how far government is prepared to undermine and collapse collective bargaining and the dispute resolution mechanism by imposing their will on workers. We are aware that certain ministers inside the mandating committee of the employer have refused to support the new minister, Umamunotolo Kivit, to resolve the impasse. Instead, they engage in tactics to divide unions, and we want to warn them that this approach is regressive and will collapse public service. At the onset of the facilitation process, we were upfront in trying to resolve the dispute by tabling a proposed settlement agreement which entails, among others, cessation of hostilities, which was meant to see parties agreeing on resolving the strike and talking to relevant issues linked to hostilities. 2, defending the council and collective bargaining, which meant that the parties will agree on defending the PSCBC and as such the unions that are currently not part of the 2023-2024 round of collective bargaining to return to the council and participate fully. 3, augmentation of the 2020 salary increase, which meant that the state having unilaterally implemented 3% salary increase for 2020-2023 financial year will augment at least 3% with a percentage to be agreed by parties. For minimum service level agreement, that parties agrees that the long outstanding issue of the minimum service level agreement be concluded in council within the period of 6 months. As Nehawu, we want to register that it's becoming quite clear to us that despite all our efforts to resolve the dispute, the government is not interested in concluding the 2022-2023 dispute, as they argue that they have closed and concluded the negotiations in that financial year. This was despite the fact that there was no resolution for that financial year, but rather a unilateral implementation of the 3%, which was way below the CPI. With this arrogance displayed by government, it is important to confirm that Nehawu continues with the strike in a more intensified manner as from tomorrow, Monday, the 13th March 2023, to demonstrate to government the seriousness with which we take the concerted efforts to underplay the role and the significance of public servants who are at the coalface of service delivery. We have a duty to protect and defend collective bargaining and the rights of workers in the face of the employer's drive to degrade and break it down. Section 23 of the Constitution on the right to strike is sacrosanct for us. Indeed, this government continues to show us the middle finger and display a high level of arrogance as it is totally disregarding workers' plight, even with this ongoing facilitation process at the Public Service Coordinating Bargaining Council. Hence, the strike continues until the government accede to our demands. Is a luta continua. Workers have endured for far too long the brutality meted against them by this callous government. That's where our statement ends. We will await to get a question to respond.
Thank you very much, General Secretary. We will now invite questions from the media in relation to the statements that have just been read out by our General Secretary. Thank you. Yeah. So you will just introduce yourself and the media house that you come from. Number one, Katlepo, Indaba. All right, now you can shoot.
Okay, so let's hear from UFM. Just looking at the past week, I agree with how the strike was conducted, blocking the public facilities, or do you think should have been handled better? And also, my second one is from the Minister of Health, Mr. Joe Parker, mentioned that there were 4 deaths that could have been prevented and he attributed them that could have been because of the strike. What's your reaction to that?
Gabriel Supporter from Newsroom Africa. I will send some content from residents near the Rahima Musa Hospital in Coronationville who were fighting against members of Nehawu who were trying to demonstrate outside that facility. As a union, how are you going to deal with perhaps communities which feel resistant to the strike?
That's from the SABC. Mine is on the bargaining council. The discussions are ongoing at the bargaining council right now. You're saying that it seems that there's reluctance from certain ministers in terms of supporting the new minister in terms of her handling of this process. Are you able to shed more light in terms of your engagements with the new minister? How far have you gone in terms of her actually intervening in this regard? Also looking at the fact that last year there was a memorandum that was given to the acting minister in this regard where you tabled your demands. Has there been some sort of interest coming from the new minister to entertain all of those that you've raised last year? Again, just touching on what my colleague said there, the losses of life. We had that some losses of life might be attributed to this strike action by the workers. Even for Gauteng going to an extent of interdicting and just making sure that the police and law enforcement are deployed outside of the facilities, because it seems like the strike has gotten out of hand. What is your reaction to that? And have you managed to at least just try and find out from the members that are demonstrating on the ground that they are not in turn just trampling on the rights of those that may want to get services provided to them by some of these health facilities?
My question is around the issue of essential workers being on strike. Of course, we know that government has said that this is illegal. In fact, I think it's one of the arguments that they made in court on Friday when they said that they're breaching the law by being on strike. So, has the union taken any resolution as far as essential workers are concerned? Are you going to be calling them back to go to work, or are they going to still continue the strike?
All right, thanks. I will now hand over to our leadership and then we'll come back for a second round of the questions. Thank you.
Present. Anyone wants to? Okay, I will we'll share the responses of the questions. Let me start. I'm not sure whether I have captured correctly. UFM. Yeah. We are happy, whether we're happy with the strike, blocking access and so forth. I do think that we need to register this fundamental point. That firstly, hospital is like any other workplace where you find a member of Nehawu, becomes a workplace for us. Once we receive a certificate to strike, we exercise our right at the workplace to strike. We withdraw our labor at the workplace. So that's what firstly we wanted to clarify. But having understood that, we had written a letter to all provinces, in particular Department of Health, a week before the commencement of our strike, requesting that all provincial health departments must meet with representatives of Nehawu, particularly at the institutional levels, particularly in hospitals, where there will be discussions that clarifies as to balancing the exercising of our right vis-a-vis the service, with a view that they must develop mechanism and put measures in place so that coherent to a strike, also services attended. We have done so. Remember also, it's not us who have a responsibility to make sure that hospital are functioning as government, but we do, because given our orientation as now, we realize the impact of our strike in that service. So that's why we then arranged that kind of a meeting so that we can find a way of balancing the service on one hand and the right that must be exercised. But unfortunately, government showed us a middle finger. They have told us directly in writing, others in meetings, that it's not their responsibility to ensure the functioning of hospitals. And that's an unfortunate situation, and we needed to exercise our right. That's the first point that we want to make as a response. The second point, we have issued a statement consistently as and when the leader of Nehawu is interviewed, because that question is not new. We have always been responding. Even yesterday, formally, we have responded that all departments in provinces except Northwest, they've interdicted not the strike, they've interdicted the activities associated with matters of intimidation and so forth. And we have called our members to comply or to work within the framework of those interdicts while continuing with the strike. So that's how we feel that, that's how we think that we must respond to that question. And I'm taking the last question. Firstly, I want to communicate that it's an unfortunate situation to lose a life of any human being, wherever that life is lost. And we want to reserve our right on the allegation because we are told, actually, though the minister was once registered being conclusive that 4 lives have been lost as a result of the strike, the same minister in the same interview contradicts that, says that they are investigating the possibility because they are collecting facts about that. We do think that as a union also must be given a space to exercise our right to await for the conclusion of that investigation by the state, and therefore, once that is public, then we can respond to it. We don't want to interfere with the investigation by pronouncing now, because it's a serious allegation made. Because we are created as a union that encourages genocides. And that is totally an opposite of who we are. So we will want to deal with that as and when that is conclusive on that, because currently there is no conclusive finding that points to us. But also equally, the department must not run away from their responsibility. The state is responsible to provide healthcare service because it's our constitutional rights as citizens. So the state must take full responsibility of any incident that would have occurred at the hospital. While we respect the investigation, but also they must also recognize that they are accountable to society. They have to respond how that thing had happened than to be dark and diving and wanting to choose other people. So that's why I will stop and I will allow the leadership to take some few questions. President.
No. Thank you very much, Nobal, and greetings to the journalists. And indeed, greeting to our members out there. And before I answer questions, I want to use this platform to welcome all those workers who have taken a decision to start to join the strike tomorrow. Those workers of the unions that were not yet on the strike, because it should be important to be remembered that, yes, for some reasons that we don't know, Nehawu has been isolated and singled out as the only union on strike, whereas there are about 8 unions in dispute that together and collectively have received a certificate to strike. So perhaps other unions will have planned to commence their strike on a different time and date than ours, but we are not the only one on strike. That is why when the GS says we need to reserve our right, is that when there are activities that offend the public, such as what is being alleged here by the minister, it can't conclusively immediately be linked to that is Nehawu, as if it's Nehawu only in the picket line. But the comments of the minister and the disparate attempt to link the loss of lives to the strike of the union, we know they're going to do that thing because they are a state. That's what states do in their quest to defeat workers and crush the strike. Not only they will intimidate workers on dismissals, no work, no pay, they will use courts, they will use police and soldiers, but also they will use propaganda machinery to turn the public against the striking workers. They are determined, as we are saying in our statement, that never before have ever seen a very determined and committed state that wants to defeat workers. Not defeat them in the bargaining councils only, but erode all their rights, but defeat even their organizations and defeat workers from whatever they might be wanting. And this, it's a coordinated, the entirety of the state, not against Nehawu, not against the striking workers, but against workers. It's not a new thing. So that propaganda, we understand it very well as such. On the communities that sought to prevent or to fight with the workers that are on the strike, we shall at no point take up a fight with the communities. We regret, we don't know the circumstances, that community felt they need to defend themselves, or not necessarily defend themselves, but prevent workers from exercising their right to withdraw labor where they work. Because workers were withdrawing labor and demonstrated where they work because they agreed with their employer. Communities are recipients of services that are provided by public servants. But the workplace is a workplace belonging to the employees. And when they decide that today we're withdrawing our labor, it's unfortunate that they have to fight with the recipients of the services. Our anger is not directed to the recipients, to the clients, or the communities, but to the state as an employer and the state as an institution. So we will endeavor to avoid confrontations with the communities, because part of our demands while we're on strike seeks to strengthen and capacitate the state institutions, the public service institutions that are supposed to be providing quality public service to our people. Currently, very few, if any at all, public service institutions are fit for purpose to deliver services that our people demand. And that's the reason why, as Nehawu, have embarked on a public service delivery campaign, firstly, to highlight and expose these deficiencies in the public service institutions, but also to make the public aware about the conditions under which these public servants that today are being vilified for striking are working. That deaths happen in the hospitals because the healthcare workers are helpless, they can't help them. Deaths happen in the hospitals because there are no resources that they need to give to these people. And these workers are helpless, very frustrated, traumatized, because they can't help their communities. These communities are not people who are coming from some planet. We live with them. When they wake up in the morning and go in queue, that very long queue in the hospital, we find them there. We return them back at 7 o'clock because we could not finish the queue, because we were only 3 instead of being 10 in our place. It's not because we are lazy that the queues are so long. It's not because they are lazy that others die on the queue. It is because we just don't have sufficient staff. We have got the burn-out nurses that are forever on sick leave because they can't have even a break. We have an infrastructure that is collapsing, that is not working, that a nurse or a clerk in Home Affairs have to go to the nearest tech shop to relieve themselves because toilets in the hospitals are not working. So we have no business fighting with the community. These are the people that we are also fighting on their behalf, that there must be enough staff there, they must fill vacant posts, there must be motivated staff, because currently the public service is filled with demoralized workforce, underpaid workforce, overworked workforce, frustrated workforce. These are the people who saw their colleagues during 2020 and 2021 die in front of them. They could not even go to their funeral. When everybody else was locking himself or herself behind their doors, these workers that today are being vilified, they were out there trying to defend the nation. They died. They took diseases from the transport intersections and from hospitals to their families. Their family members died. This period is the period that they did not get a salary increase. 2020, 2021, no salary increase, not whatsoever. Today they are accused of killing the patients. By the government that it didn't give them a salary increase at that time. Actually, in 2020, we had to take the Minister of Health to court to prove that workers and the communities are not protected in the workplace because all those buildings are not compliant with OHS. And there was no PPEs. They were denying. We had to go to court to prove that point in time to defend the public that today we are accused of neglecting. We fought for the public in court. We fought for the public in court in 2020. So it's good because they have everything, the ministers. They are a state. They can say whatever they have. They've all the machinery. The only thing workers have is the bargaining council and their labor and their result in the unity. Other than that, they are helpless. And this state is determined to crush them. But again, it has been coming because people must ask themselves a question: why is it these workers are so resolute this time around? When last did we see this kind of resoluteness by workers, including the healthcare workers? Does anybody cares to ask that question rather than concentrating on the things that are there and the fact that public is suffering and the fact that state? Isn't there a need to ask why is about 10 years like this? Is it because these workers all of a sudden they have been infected by some mad disease that all of them across the country they just pop up everywhere else and blockade the roads? Surely we have a responsibility to go beyond what we see now. Now, I don't know. The fact that even today, even as of last night, our negotiators slept at the PSABC. On Friday, they slept at the PSABC. It is because the understanding we had with the new Minister of Public Service was that we want to conclude this thing this weekend. She was saying to us, I want this thing concluded as yesterday. We don't have that experience or experience of that commitment since Senzo Mkuno arrive in the public service. Because he is the one who started all this nonsense. He's the one who reversed and collapsed the public service that we know, that we've worked for hard to transform since 1996. And everybody else that came, including these other ministers that are advising them, they have been taking off from there. We have never seen a committed minister to try and want and resolve matters as urgently as possible. And then the process was blocked somewhere else. By the old guard that have always been there, that actually are the architects of the miseries that workers are facing today. They want to defend that posture, they want to defend their egos. It has got nothing to do with the facts and the possibility of resolving this issue. It has got everything to do with their egos. That's why they're frustrated in that minister. So that's how far I can go in terms of the process, because the progress supposed to happen where negotiators are sitting. And the facilitation process is supposed to be ongoing as long as there's a political will that is backing that process. And from the onset, we saw the minister that was prepared to politically back that process that is now being frustrated. Now, I think we dealt with all of them. UFM, you would ask whether we are happy in the manner in which the strike is conducted, and the GS responded properly with that. But I think you should have also asked whether we are happy about it's one part that we're supposed to be happy about too. That I think workers have outdone themselves this time around because of they have been suffocating for such a long time. When we kept on saying we are negotiating, they felt, but when are we going to be allowed to defend ourselves? Because we have been butchered here. So that's why we are welcoming them. Those are coming, but we are also encouraging those who are there to stay fast, because the chaos in the public service have been started, they've been oncoming. And we said so in 2020, February, when they reneged on Resolution 1 of 2018, that you are walking away from a rules of engagement that have been established, which is called collective bargaining. When you walk away from social dialogue, we are walking into chaos and anarchy. If you abandon peaceful negotiations as a state, as a government, or as an employer, what else is left other than anarchy? They declared anarchy there in February 2020, this state. That's what we are seeing, the things we are seeing now in our country, which is unfortunate. Thanks.
Okay, no, thanks. Just two areas I want to just add from what the President and the GS has indicated. You know, we are aware that one of the tactics that are being applied to undermine our strike is to rush to conclude an agreement in the current wage negotiations for 2023-24. In fact, the plan was to do that last week Friday. The facilitated process, disturbed that. We were told now there's a special council meeting coming either tomorrow or Monday, so that they can close off as a tactic to defeat us, to undermine our strike. But what they don't know is that the 2023 agreement that they can sign will not make this dispute disappear, because that agreement has nothing to do with the 2022 dispute. The dispute will remain. So you can't run away from resolving a dispute. It's not helping anyone. So government has a responsibility to resolve this dispute. as unions in the strike, we don't have a mandate to negotiate a new agreement for 2023-24. Workers have not given us that mandate. Workers have given us a mandate to resolve 2022-23 wage dispute. So that's the tactic that they are applying. The second thing I want to just deal with is Mangoba's question: are we going to call out essential service to strike? In the health sector, not all category of employees are declared essential service. So when we call workers on strike in the health sector, it is those that do not fall under the essential services, is particular your corporate services, your administration. I think it should be understood, because sometimes people are made to believe that anything and everything in the sector is essential service. We know that there has been attempts by the Essential Service Commission to bring in the declaration of essential service those workers that are not falling under. They've tried that. It doesn't work up to this far. So it is those workers that we want them to continue to strike. So impression must not be given that we now just decide, to collapse the public health sector. That's not true. But again, it is not correct for government to suppress the right of the rest of the workers to strike by just refusing to conclude minimum service level agreement. Because that's legal, that's the law, that's what the law dictates. It says once you declare a sector essential services, the next step is to agree on minimum service level agreement so that workers can exercise their right. Now, since the sector was declared, government has been refusing to enter that because their preoccupation is just to deter workers, is to deny workers their right, but deter them from, participating in any form of an action and so on. It's unconstitutional. It is wrong. I think it's a matter that we're not going to leave lying down going forward. We're going to pursue that particular issue until the end. Thanks.
Actually, DGS, that tactic is a lousy tactic born out of desperation to find a way out to this impasse. But that also will be a victory to workers because we are aware they want to augment what they've provided as a make-up and create an impression about this strike. So thanks to this strike for forcing them to think along those lines, even to shift from where they are, because it's a victory to workers. But that doesn't mean the current dispute is done or is over. It will remain. So that's the point that we're making. And we want to warn them, whatever they do, because they think that they can log or have an agreement, but workers will benefit, and the dispute, they are still stuck with it.
Thank you very much, Comrade GS, President and DGS. I will open another round if there are any other questions that I think are there. Nama, are you comfortable?
Yeah, it's fine. Covered everything. Covered everything.
So, Mangoba, second round. Let's start here. But before we start there, let's just take a question from Yugeshni Pillay from the Mercury. Yugeshni is asking, what is there any concern that Nehawu will be taken for qualification over the protest, the violent protest, and also preventing patients from receiving medical care? The second one is, what would Nehawu like to see from the government for it to call off the strike? The third one is, what is Nehawu's current position on the strike in relation to the facilitation that are happening? Those are the questions from Yugeshni Pillay from the Mercury. Let's introduce yourself in the media house, and then you can pose the question. Thank you.
Thank you very much. Yes. My name is Amadam from Alex at home and also from British. A quick one from me is just I want to find out what are the concessions? From the reports that we have here, it looks like this 10% is highly impossible. So I want to find out from you as the union, are you willing to compromise? How far less are you willing to go below this 10%? Yes, that's my question. Thank you very much.
Dr. from the SABC again. Mine is on tomorrow's process. So you know that the matter is back in court for a judgment. What would be your expectations where that process is concerned? And in terms of the COSATU blocks that are set to join in, PAPRU will be joining in tomorrow as well in terms of the withdrawal of the enabler. Do we expect tomorrow's judgment to also have a bearing on other unions that have made an indication that they'll be joining Nehawu on the downing of tools as this week commences? Thank you.
I think Kateko is taking some parts of my question. And thank you for that, Kateko. But I just wanted to know, is there indication, are you talking with other unions as well, including the North Side, other unions, possibly
What was Banyasel?
also
Madam Mayor,
also indicated that they are joining the strike, that I think they're going to strike. What is the move like with other unions? Are they willing to join the strike to intensify this action?
Normally, you can come to.
I just wanted to ask, I think it's just a piggyback on Okuji's first question on concessions. Since Friday or the 10th of March, 11th of March, is there any offer or new offer that is put on the table that perhaps the union rejected during these negotiations that have been happening? And then also, I think people would already say that the strike has already been intense, but you're promising on amping things up. Can you just maybe outline by intensify what you mean?
Ufuna zireview strategy zethu publicly.
Okay. All right. No, thanks. There may be others that I missed, the one that come from online. You may reflect them back. But I will link the one that I got with the question from my brother here. What would we like to see in order to end the strike? The reason we worked throughout the weekend is because we didn't want the strike to continue tomorrow. We had hoped that in the facilitation process, you see, when you have a deadlock, you have a dispute, you have a process of dispute resolutions, you have a strike. To end that hostilities is to settle. So when you settle, no party is where they were when the dispute arose. So in other words, there's no win-win here or win-lose. It's a question of all coming to a middle ground. We will have hoped to have signed by this time around a settlement agreement at a facilitation process that takes us to the real bargaining process so that we have a resolution. That's all we've wanted. I'm answering the first question. You're asking about, they are saying the 10%, it's unachievable, so what will be the concessions? What will be the compromise? You must remember that when we started negotiations in May in 2022, we were at 10%, as our statement says. The employer was at 0%. Zero. You come to the table with workers, you have zero, and you say you are bargaining. You respect collective bargaining. Fast forward, they moved up to 3%. By the time they were at 3%, we were no longer at 10% ourselves. We had moved down. The only thing we were fighting for was nothing less than inflation. Because that's why that part of the collective agreement, because there are many things that we demand. But that part of the percentage is called COLA, cost of living adjustment. There can't be a cost of living adjustment that is less than inflation. Otherwise, you don't know what you're talking about. If it can't be a cost of living adjustment that is less than what actually the living cost. So what are you adjusting? So that's a big thing here, that there's a gap between where they are and where the inflation were and where we were. That's what we want to up. And maybe let's say, so we went back to the 3% because by collapsing negotiations, it meant that there's no engagement, especially when you are sitting in the bargaining council. You know that day, Minister Gordon once told the public that Usizamile, because they don't even believe we deserve what they go for. They think they were doing us a favor. Usizamile, 3%. The negotiators were busy in the bargaining council, the SABC. He didn't think that process is important. He left them there. These ones, they were negotiating there, trying to find a solution in the conciliation process. He left, he went to Parliament. We're not represented in Parliament. So they abandoned the whole process of bargaining. And they announced that I'm closing this in Parliament, not in the, I'm closing this, I'm zamming them with 3%. So and the minister clapped hands, no, they clapped hands, they are happy with the language he's using. Because it's one thing to do your job, it's another thing to be sarcastic when you're when you're dealing with workers' plight. Because you're actually insulting them and provoking them more. You're insensitive to their plight, you think it's a joke. You know? Now, if we go to the table and want to sign a settlement agreement, we're starting negotiating, therefore, it will be the outcome and the product of the negotiations during the trying to find a settlement that will determine where we settle. We are not unreasonable. We are not unaware of the fact that others already started or should be actually started another bargaining. We want to be there, but our members have not given us a mandate to do that. They have given us a mandate to defend this one and protect the collective bargaining, because this is an issue of collective bargaining. Not since 2007 that we used to get an inflation plus related increase. It was after a very long month strike of June in 2007 that we signed an agreement that ensured that it's inflation plus. And it was vowed and agreed that never before shall the increase be anything below, even if you give us 1% above the inflation. That's fine, because you have given me an increase. Because if you don't give me 8% above the inflation, there's actually no increase. There's actually no increase. If you give me an inflation, fine, we have adjusted my cost of living, but you didn't increase anything. But if you give me inflation plus a percentage, then you have increased my salary by 1%. Then I can take that. This new tendency now of even giving below inflation actually goes against.
Hello and welcome. This is The Week Ahead with myself, Liesl Wilson. Live on your screens from Braamfontein, Johannesburg, is a press briefing from Nehawu leadership. This is with regards to an update, really just coming out to announce that the union, in fact, will intensify its strike action. This is heading into the second week as they await a decision by the Labour Appeals Court on Monday for judgment on the legality of the demonstration. So we've heard answers from Michael Shingange, who was on your screen, Nehawu president. Also addressing the media was Zola Sapeta, who's the general secretary, as well as December Mavuso, deputy general secretary. So that is a story we'll continue to monitor throughout the week. For now, we'll leave it there and take a quick ad break. Continue upon our return.